Good morning, lovely people. How are we? So your girl is doing her makeup, and why am I looking sideways on into the mirror? Because, well, actually it's my phone. It's because of this. You see this? So this is a post-Botox bruise. Yes, it happens if somebody's sticking a needle in your face. However, professional and medic they are, and my person who does mine is a medic, a doctor, and you bruise, and I do bruise pretty easily these days. Have found any people watching this? I'm over 60. Well, I'm 60. Since menopause, I now bruise a lot more easily. I don't know why. Well, maybe it's something to do with the vascular system. The skin's thinner. The skin does thin as we age. So just to let you know, I would say probably since 50, I bruise a lot more because I used to have my Botox done. I've been having Botox done for years and not get a bruise at all. And now I often do. But that is the reality of the situation. But I thought I'd show you what I'm doing to cover up. And also, I had my lips topped up yesterday, a very small amount. And again, some bruising. This is what happens. This is post treatment. And now, I used to work many years ago in cosmetic surgery. And I can tell you, some of the bruises I saw then, post-surgery, were pretty epic. But that is the reality. If you're having a procedure, however small, if it involves needles and incisions, bruises are likely. Anyway, so what am I doing? I'm going in with my NARS. This is it's called Night Swan. It is a light reflecting concealer. Now, I used to work for NARS. I was an MUA. I am now a stylist. And I like this product. It's kind of like its cousin, the NARS Matte Concealer, but with light reflecting properties. Now, I've gone in with this one because bruises are hard to cover up. They just are. Because of the depth of the pigment, you've got the blood pooling underneath the skin, and they often will show through. So, you know, sometimes it's just about making the best of it, unless you've got a really heavy duty concealer, such as Dermablend, one of those. And I used to know some professional makeup artists, so they would use some really professional products to cover up tattoos and bruises. But it's not easy. It's very much a layering technique. Anyway, but I haven't got the time or the product, so this is pretty much everyday Joe. Because I'm an everyday, well, I'm not a Joe, I'm a Felicity, but I'm an everyday, ordinary 60-year-old woman. Probably a little bit of a influencer wannabe, but, you know, hey-ho, I'm just doing me. Anyway, so I'm going in with this one. Now, obviously, the light from my makeup room, and I'm going to go in patting this. Pat, pat, pat. Don't rub, because you just move it. So you want to stipple it in. Now, it probably still will be there. I've chosen this one today because I sometimes find my other concealers look a little bit orange. Because generally speaking, I don't wear foundation or concealer very much these days. I do wear other products on my skin, but not so much those ones. But because I have these bruises, it's concealer. So I always have it about my person. I'm using my Bobbi Brown full coverage full coverage touch-up brush because I like it, and I'm going over and round and down my brows, into my hairline, across my temples, on the end of my nose. I'm pretty much, I mean, I suppose you could almost say it's like a foundation, really, isn't it? But without the full commitment, I don't like putting on foundation. I don't know why. And then I blend it down into my cheeks. I do have a dry beauty blender, which I do like to use. And that there was Amelia, but I got it out. I can do that. I'm trained. I was a level 3 beauty therapist, and I've done various advanced training courses, so I have the right equipment to remove milia. But again, Milia are a lot deeper than you think you are. You know, those little white, well, I suppose you could say it's like a spot that are under the skin. They have no head. They don't come out. They're not. It's not past what it. Well, it's sebum that's trapped underneath the skin, and there is no open pore for it to come out. So it forms this sort of little hard nut, and they're actually a lot deeper than you think you are. They are. Sometimes you can get them out, but majority of the time you actually have to sort of really pierce the skin and squeeze them out. So, you know, not to be recommended with your fingernails or the end of the scissors, people, because you are going a lot deeper. And I use a sterile implement because I have it. Because I have access to these things because I was a trained beauty therapist level 3 with some advanced courses under my belt. Done a lot of stuff over the years, I have. Anyway, the reality is I'm not that bothered. If people see it, they see it. What can I do? I don't sweat the minutiae in life anymore. It is what it is. I wish I didn't, bros, but I did. Anyway, I'm sitting here rabbiting on. I am wearing my new Zara jumper that I bought yesterday. It was $25.99. It's really soft and fluffy, and I'm rather loving the scalloped edges. And I'm sitting here with my dressing gown around my waist because I'm cold. Would you believe? Would you believe? Bit cold. Autumn's on its way, but I love it. So I'm just going in with my brush again. I probably spend an inordinately long length of time doing this. It's not a quick job. I've always been like that. My base is so important. Get the base right and everything else follows, because basically anything you put on your base sits on top of it. So if that is not right and good and comfortable and set and on hydrated skin, it ain't going anywhere, ladies and gents and anybody else that's watching. If anybody else is, someone's dog maybe. Oh, and their cat, possibly a hamster. Who knows? All welcome, I say. I'll take any followers. That's for sure. That's for sure. Anyway, so we're getting there. We're getting there. And obviously, because I have was post-injection yesterday, I am being somewhat gentle. I'm not going in like a prop forward. It's a rugby position, I do believe. My ex-husband used to play a bit of rugby, and I think it was a hooker actually, but you know, hey ho. Tea with collagen in it actually. Excuse the slurping, how rude. Anyway, now I'm going in. We have not much time left. You're probably sitting here thinking, get on with it, because I'm thinking that myself. But I just wanted to show you how I conceal some post-treatment, aesthetic treatment bruising. And I also will then put my Bare Minerals powder. Now, if you can be bothered, I will do another video. So there'll be another 10 minutes of me prattling on. But the makeup will be a bit further down the line. But although this may not seem the most scintillating thing you're going to find on TikTok today, and probably there's some really crazy shit out there to watch, I've just come across a cat's Instagram. It's hilarious. Anyway, you know, this is real. This is what real people, and particularly people my age, at the grand age of 60, still doing it, still rocking, still working. I just bruise a little bit more easily. I'm a sensitive flower. But anyway, there we go. See you later. Watch part 2 if you want. Thank you for watching this far. Have a fabulous Friday.